Okay, today we're talking about the world's oldest known surgical procedure, trepanation. And, the evidence we have for it just completely flips the script on what we thought we knew about ancient medicine. It proves that thousands of years ago, doctors weren't just trying to do brain surgery, they were actually succeeding.
So it all starts right here with this skull from ancient Peru. For the longest time, the story seemed pretty obvious, right? This had to be a victim of some kind of brutal attack, a deadly wound from a weapon. But when scientists really started looking closer, that whole story just fell apart.
And that brings us to the big question. Are we looking at a fatal injury, or is this actually the hard evidence of a successful, life-saving operation? Well, the answer is pretty mind-blowing. See, the key to figuring this all out lies in how it was done. This wasn't some crude act of violence, no way. This was a delicate procedure, and it was performed with a surprisingly precise set of surgical tools. The tools they used were just incredibly sophisticated. We're talking obsidian blades, which, get this, can be sharpened to a molecular edge that's way sharper than our modern steel scalpels. They had specialized bronze knives, finely made stone scrapers. These were not tools of brute force. They were instruments of absolute precision. And the surgery itself? It was so methodical. First, the surgeon would carefully scrape away the scalp. Then, using those incredibly sharp tools, they would just patiently, slowly, begin to cut or scrape a hole into the cranium. The whole point was to relieve pressure on the brain, usually from a serious head injury. So they had the right tools, they had the technique down. But here's the million-dollar question, right? Did the patients actually survive this? Well, the proof is written right there on the bone itself. This, right here, is the smoking gun. If you look really close at the edges of that hole, you'll see they aren't sharp and jagged like a fresh wound would be. They're smooth, they're rounded. That, my friends, is bone regrowth. It's a biological process that takes years, and it proves not only that the patient survived the surgery, but that they lived for a long, long time afterwards. And it gets even crazier. In some places, like in the Inca Empire, where they really perfected this procedure, the evidence points to a survival rate that is just staggering, as high as 80%. Just let that number sink in for a second. To really get how incredible that 80% number is, you need some context. Fast forward thousands of years to the American Civil War. The survival rate for a serious head wound back then, less than 50%. That means ancient Inca surgeons were, statistically speaking, more successful at saving their patients than American doctors were in the 1860s. It's unbelievable. So what on earth would convince someone to go through with such a dramatic, risky procedure? Well, the reasons were surprisingly modern, and they were all medical. Yeah, this wasn't some kind of spiritual ritual. Trepanation was a targeted medical treatment for real problems. Most often, it was used for severe head trauma from battles, to clean out bone fragments and relieve dangerous swelling. But the evidence also suggests it was a treatment for chronic debilitating headaches and maybe even for neurological issues like epilepsy. So when you put all these pieces together, the precision tools, the methodical technique, the clear evidence of healing, and those incredible survival rates, you can only come to one powerful conclusion. We have to throw out that old, tired idea that ancient automatically means primitive. The success of trepanation shows us a deep, sophisticated medical knowledge that existed centuries, even millennia, before we ever thought it was possible. I mean, really think about what an 80% survival rate implies. To pull that off, these ancient surgeons must have had a working knowledge of sanitation, of infection control. They understood cranial pressure and how to safely relieve it. These are foundational principles of modern neurology, and our ancestors had them figured out long, long ago. And that leaves us with one final, really big thought. Trepanation is like a little window into a lost world of advanced medical knowledge. And it makes you wonder, if ancient people could master something as complex and as dangerous as brain surgery, what other ancient wisdom have we completely underestimated or maybe even lost to time? If you want to explore more incredible stories of ancient brilliance just like this one, make sure you subscribe to Ancient Archive Blueprints. We're all about unlocking the past and showing that ingenuity has always been part of the human story. Thanks for joining me.